Hi, I'm Dani Gasparini, and welcome to this segment of Penn Voice. I'm joined today by Bart Charlow, who is the CEO of Samaritan House. Bart, welcome.
Thank you, Dani. It's
and
good to
you've
be here.
you've been on the job for not too long, taking the position left by Kitty Lopez.
Yes.
So for the few people in San Mateo County that might not know about what Samaritan House is and who you serve, just tell us a little bit about Samaritan House.
Well, Samaritan House is your original and probably one of the strongest of the anti-poverty agencies in the region. We serve San Mateo County, and we serve over 12,000 people every single year. That's families and children and seniors, people who are disabled, people who are homeless, mostly people who are working poor. So it's a tremendous amount of effort that we do.
And you have a rich background in community service. Tell us a little bit about what you were doing prior to jumping on board at Samaritan House.
Well, most immediately I was working with another agency locally serving seniors, Peninsula Volunteers. And I've worked with Easter Seals and National Conference for Community and Justice and quite a few other agencies in the area.
And so one of the things you and I talked about before the show started is your absolute appreciation and amazement for how much this organization does, the people it serves, and how vital it is to the San Mateo County residents. So let's dive right into that.
Okay. Well, we do everything you need to survive and thrive for the people who are most needy in our community. So we're talking about food, shelter, clothing, but we're also talking about all forms of health care, and on top of that, financial empowerment, jobs, advocacy, everything you need to bounce out of the cycle of poverty and get back on your feet. And that's really what we do. Mm-hmm. It's a tremendous amount of work, and I am just floored. Every week that I go in, I learn something new that we're doing. It's not publicized, but it's just as vital to the people who need us.
It is one of the best kept secrets, if you will, and hopefully with this show and other things that you're doing, we can let people know about what you're doing and the work you're doing so that people can support Samaritan House and or find your services. I look at Samaritan House as one of the best collaborators in San Mateo County. I know you, when you talk about healthcare and when you talk about feeding the hungry and when you talk about shelter, you don't do it on your own. You're working with some other great agencies. Tell us a little bit about those relationships.
Well, there are a lot of relationships. It's very deep, very wide. If you talk about healthcare, for example, our two free medical dental clinics, one in San Mateo, one in Redwood City, cooperate with the private healthcare providers and the county systems, the hospital systems. So we have arrangements with...
And volunteers that are doing the dentistry. And or the physicians.
Yeah, the clinics are primarily run by professionals who are volunteers themselves, and they absolutely love doing it. So they're providing the front line to prevent people who have no Medicare or Medi-Cal or insurance coverage, even under the Affordable Care Act. They've got nothing. And we are keeping them out of the emergency rooms. We're keeping them healthy, able to go back to work, take care of their families, handle even long-term chronic medical conditions. And the cooperation between our volunteer doctors and our clinics and the hospital systems locally is extraordinary. We even have doctors and medical systems, radiology groups, for example, pitching in services out of their own pocket just to make it work.
Right. And I also find the collaboration from each of the cities and the county itself in supporting Samaritan House is one of the most important things that I think that we can do as a community to make sure that these services are being put forward to our citizens.
Well, I couldn't agree with you more. We are a core agency, and what that means is the county looks to us first in the most populated central belt between Millbrae and San Carlos. But in fact, we collaborate with the other core agencies, the other 8, around the entire county. And in fact, we administer the funds that they would use, just as we do, to provide rental assistance or utility assistance or all these other things to help people keep from becoming homeless.
Right. And you're the professional organization that knows how to do this. I think that if cities and counties tried to provide these kinds of services within their own systems, they would find that it would cost quite a bit more, and you have the ability to use volunteers and to create these great collaborations. So we, you know, that old saying, we're getting a great bang for our buck. We really are when we talk about Samaritan House and all that you've been able to do with regard to bringing the community together to work on these issues. The same thing in the food service. Tell us a little bit about that.
Food service, last year, for example, there were almost 155,000 meals that went out. We didn't have to go through any bureaucracy. We didn't have to go through anything complicated.
Right.
We collected food, including from our partners at the food bank, but also most of the grocery chains and stores in the area, some of the restaurants. And we put that together every day, and that goes out by the hundreds all over the place. So there are mobile meals for seniors and people with disabilities who are at home. There are dining sites where we hand out meals. We're missing a dining room, so if any of your viewers out there have got a good one for us for a couple hundred people, we'd love it, because that's the way we like to have people served.
There might be someone that's calling right now.
They might. We have a food pantry, so people come by every week, every month to get groceries, to shop for fresh produce. We have family harvests, in which case entire families come out and volunteer to give food out to other families who need it. And you can watch them go down the line and pick up a chicken and pick up vegetables and juice, whatever it is they need. And it's just, there are so many meals. In the summer, what we do is we feed those children who would qualify for school lunches, but for whom there's no school, so there's no lunch anymore during the summer. So there's more than 19,000 meals will go out this summer, and snacks to those very same kids. Make sure they don't go hungry.
And how do you then ensure that you're not duplicating services, that you're actually working collaboratively with other either shelter organizations or other medical organizations or other food providing organizations?
Well, there are a couple of ways. One is by the integrated data system that we use with the county and with a lot of the other providers. But in fact, we kind of co-locate. So we may have somebody from one of the other shelter agencies at our homeless shelter helping us work to bring people out of it into temporary or permanent housing.
We could actually take a page out of that in the business community, working collaboratively in that way. Very cost effective.
You're good. We're not suing each other, we're helping one another.
Exactly.
And it really works beautifully.
Well, you must be doing something right. You're about to celebrate your 40th anniversary.
Yes. And
So
we're
tell us a
proud
little
of
bit,
that.
what's going on?
Well, we're going to have a terrific event to try and gather all of these folks who are involved in our services and producing them and funding them and everything else, just for fun. And we're going to do that on October 17th. It's an every-person event. We call it a community appreciation event.
Great.
And it's just going to be terrific fun. No fundraising, just come and meet all your old colleagues, you know, the folks you were on the line with serving food, and have a blast and reconnect. But we celebrate every day with the work we do and the joy you get out of being able to help somebody else and know in your heart that this was really needed and you really did something.
Right.
This is neighbor helping neighbor, Dani, and that's our slogan, and it's reality.
Yeah. You do have happy people that are volunteering. It does the heart good. So you talked about a little bit about the volunteers. You talked about you need community support, you need sponsors and donations. Where does all of that come from?
It comes from everywhere. We're about 45% from government sources and from the two healthcare districts in our region. That's the Peninsula Healthcare District and Sequoia Health District, both of whom support our clinics. The rest is coming from what fundraising we do, individual donations. We probably get $1 million or more in kind for things like food and clothing, and these are vital. It's what makes it go.
And not to mention the volunteer services. If those had to be paid through salary, what that multiplier effect would be is tremendous. So you do a great job at bringing that volunteer to the table.
There are 2,000 volunteers a year, probably 20,000 or more over the last decade alone.
So we just have about a minute left. What are some of the challenges that you're facing as an organization?
The biggest challenge we always have is finding enough volunteers when we need them and finding enough funding to be able to do the work, because there's so much more need, Dani, than we're able to hit.
Right. So maybe this program will be something that all of a sudden you'll see a spike in people calling and saying, hey, I want to volunteer. And if they do that, where do they go? Who do they call? And do I have to have any special skills?
You really don't. We'll fit you to the skills you have. And it's amazing. We have professionals who are sitting there chopping carrots, and we have individuals who are helping those professionals see clients, you know, for health services and everything in between.
And I'm sure you'll work with my time availability and how much time I can give.
We will definitely do that.
Well, Bart, thank you so much. Thank you so much for telling us all about Samaritan House. Thank you for the work that you're doing.
You're welcome.
And viewers, if you're out there and want to give back some of your time and some of your valued treasure, please do to Samaritan House. And I want to thank all of you for joining us on Penn Voice, and we'll see you next time.